And that means 1 out of every 4 residents in the Mountain State relies on Medicaid for things such as nursing home stays and doctor visits. 24 million uninsured. These are the projected numbers under the new American Health Care bill. And U.S. Senator Joe Manchin says these numbers are unacceptable. Nearly 600 came out to a town hall meeting to speak out against the bill, and emotions were high. Just last week, roughly 4,000 naloxone kits were distributed to high-priority areas in the state, such as Huntington, Charleston, Wheeling, and right here in Morgantown. In a last-minute effort to sink the Republican health care bill, a group of powerful conservative donors said they would start a new fund for 2018 Republican re-election races, but they said they'd only donate to those who voted against the bill. Back to you at the Waterfront studio. More than 500 residents packed this room today to discuss health care in the Mountain State. I'm Brett Anderson, and I'll have the story for you straight ahead. Mina Schultz was only in her 20s when she went to the doctors complaining of knee pain, but soon discovered what she had was so much worse.
So, had the ACA not been in place, I wouldn't have been able to get on my parents' plan. At that time, I would have been too old. I probably would have gone without the MRI that found my bone cancer early. And the longer you put it off, the more chance of spread. So, ultimately, it saved my life.
The bottom line is there are about 600,000 West Virginians that are at risk. Many of those people could lose their coverage entirely, and at least 175,000 can lose their Medicaid. And that means 1 out of every 4 residents in the Mountain State relies on Medicaid for things such as nursing home stays and doctor visits.
Health care is a basic human right. The bottom line is we're paying for health care one way or another. We always have. The sad scenario is we've never tried to keep a person healthy to prevent them from getting these catastrophic illnesses.
Senator Manchin admits that the current Affordable Health Care Act needs repaired, not replaced.
So is this perfect? No. Can it be better? Absolutely. But if you throw it out, I can tell you the toxic atmosphere that we have in Washington won't bring it back.
The Affordable Care Act repeal plan cuts more than $800 billion from Medicaid. Currently, 28% of West Virginia's residents are on Medicaid. West Virginia is home to the highest overdose rate in the United States at 41 deaths per 100,000 people. In hopes to combat these numbers, a $1 million federal grant is paying for the naloxone, or Narcan, which can help reverse respiratory depression caused by opioid overdoses.
So getting the antidote, the naloxone, out to the people to where they can give it immediately is vital. So we definitely welcome this plan. Again, we just want to re-emphasize that it's not the cure.
Emergency medical personnel currently carry the antidote, but this grant will make it more widely available to other first responders and to people at high risk.
You're popping down the naloxone overdose kits throughout the state of West Virginia. I think it's a great example of what the state should be doing.
The issue's been pretty bad, and it has been for a while now, so it's really encouraging to see the state attacking that issue head on, and hopefully it'll cut down on this disturbing trend.
Just last week, roughly 4,000 naloxone kits were distributed to high-priority areas in the state, such as Huntington, Charleston, Wheeling, and right here in Morgantown. Meanwhile, local EMS administered over 4,000 doses of Narcan last year. That's an increase of almost 1,000 doses from 2015. Brett Anderson, WVU News, Morgantown. With nearly 600,000 West Virginians on Medicaid, the possible repeal of the ACA under the Trump administration has Mountain State residents concerned, specifically senior citizens, and Senator Joe Manchin knows just how much this will affect them.
Life and death matters are at stake here, and people that have nothing to, will have nothing if this is gone. Make no mistake about it. The poor will be hurt. Medicaid will be cut. The elderly will be hurt.
Trump's revised plan would skyrocket prices for senior citizens, most of which do not have a constant income, which could ultimately change the way they live their life. Senator Manchin says this is simply inhumane.
Now the cap is going to go 5 to 1, so every insurance company will be able to charge a senior 5 times more than what they charge the healthiest young person. Those types of things are just inhumane.
Although Trump's bill did not pass, his plan to repeal the ACA could have seniors taking more money out of their pockets. And with increasing copay prices and doctor visits being a constant for seniors, many are unsure of how they'll be able to afford them without the proper coverage.
I went to the doctor's the other day and I had $180 in copay. So you know, how many people could afford that?
Only time will tell what the Trump administration will end up doing with the ACA. Brett Anderson, WVU News, Morgantown.